So I was really happy to see all your professional development papers. They were awesome. I learned a whole lot about everybody, and that was very fun for me because I really don't get to know you guys any other way. A lot of you are coming with some experience, and as one of our classmates wrote about, sometimes that's good, but sometimes it's bad. So but I was really happy everybody got it in on time. There was a couple late attestation questions. Just remember they have to get in 24 hours after class. So that would be Friday by 8 p.m. Eastern Standard Time. So just remember that, or else we don't get credit. And remember, that's how we take attendance. I don't, but Dr. Brown takes attendance that way. So were there any questions for this week before we start our class? No, we're all good. All right, how was everybody's week?
It was nice.
Good. Good. Mine was kind of very stressful, I have to be honest with you. And I will mention to you tonight, today has been a very hard day for me. It's 5 years since I lost my mom today. And so it's been a very emotional day for me because I'm human and I have a daughter who was pretty upset this morning. We celebrate my mom's birthday just as a celebratory time, but April 21st will always be a knife in my heart. So just if I start crying for no reason, that could be why, but I'll really try to keep it together tonight. So that's just a little bit about me. Work was really stressful for me this week. Something happened and I had to deal with it. So that was stressful. So it's been a stressful week. I think I've gained about 6 or 8 wrinkles a week, but hopefully that won't be the case for us. I hope everybody had a good week. They did their reading. We're starting to prepare. We have our exams next week, so you guys will probably be stressed this week as well, but don't worry. I sent out the study guide. I will tell you that my review sessions are usually Friday evenings, but I have a commitment tomorrow. So Dr. Apple and I are switching. So my review will be Sunday at 1 p.m. and Dr. Apple's will be tomorrow at 4. I'm sorry, let me do this in your time. 6 p.m. your time is Dr. Apple, and I think I'm 3 p.m. Sunday your time. Okay, so those schedules I sent out there on the announcements. Did everybody get to take a look? Sort of ish. Okay, don't worry. If you didn't, just take a look sometime tonight. And what I would suggest you guys do for the exam is print out your study guide. And then when you go through the review with whomever you attend, like listen to what they say, kind of highlight as they go along, because we really follow. I make a PowerPoint for my review sessions, so it'll be stuff off the study guide. So I'm going to gear you for the first test. My suggestion is this: be responsible for all the reading for the week, but we provide you a study guide for a reason. So everybody clear on that? Study guides are like a Word document. You print it out, take a look at it. I would know everything on that study guide if I were you. Any questions about our exam?
Yes, ma'am. For the review, are you going to post recordings of that as well, or is it just okay? Awesome.
I will. I'll post recordings. What happens is I don't get the recordings until the other professors share them with me. So it's not like I'm able to post them as soon as they happen, but as soon as I get them, I will certainly post them out to you guys. What I will do is I'll probably send them as an email and or an announcement. So keep an eye out on both those spots for that. And there'll be YouTube recordings just like our classes are. For our exam next week, what else do we need to know? 2 pieces of technology, a phone and a computer. It'll be on Zoom, it'll be recorded, we'll have proctors, I'll be there, and one other professor will be there. Multiple choice questions. I think you guys will do fine as long as we follow along tonight and follow some of the stuff that we reviewed last week. We're going to cover vulnerable populations tonight, which was our reading from last week, but there was so much information last week. I wanted to give you guys a little break. So we'll cover that tonight. I sent out group project groupings. And why I did this was the professors decided it was best for students to get to know other students in the class. So we just did sort of random assignments on the groups. And so I'm going to give you some time tonight to gather with the group, communicate with one another, figure out what you're doing, because you guys are working on case studies for next week. What I will share with you is if you have any problems with any member of your group, the best possible thing you can do is get in touch with me first, and then I'll be able to handle it from there. Okay. But it's a group project, and I know a lot of people say, why do we do group projects? Anybody have a suggestion why the curriculum's written with group projects?
Probably because
I
it's
wanna
a
be
community
better.
class and we need to learn how to work with each other of all different types of people.
Sure. Yep. Absolutely. That's one of the reasons. Why else?
As a nurse, you don't really get
You're-
to choose who you're going to work with. You just have to be able to adapt to whatever circumstance you are, or your coworkers or patients.
Good. Anything else, Marla? You were going to say something.
It's fine. They already said everything. I was
All
gonna
right,
say
so-
that you're
go ahead.
working you're working in a team once you get into a nursing role. So
Sure. And everyone who's in healthcare or who's ever had a job, I think we all know we don't always love our coworkers. We don't think they're spectacular people all the time, but we have to work with them, right? So unless you're the hiring manager, and even then, I had that as a role when I was a care coordinator. And the funny thing is, I hired all these people, but I didn't really work with them one-to-one, right? Because I was their supervisor. So even when you're the hiring manager, I mean, you hire who you think is good, but if anyone's done any hiring in their time, you will know that sometimes people interview really well. And what that means sometimes is they don't practice very well. So it's hard. That's a hard role to be in, but great. All of those answers, that's why. So I had group work. I was the type of person that would have preferred to do my group work all by on my own, but I learned very quickly how to work with other people, and that really helped me out. They taught me things that I didn't even know. So look at it as a positive, and I put you guys in groups, randomized, so nobody's being picked for one group or another. So our groups that we were assigned this week are going to be the same for on the syllabus. It's the wrong weeks, but so it's for next week, and then week 7 you'll have a group assignment. Week 9 is vulnerable population assignment, and that is going to be all on your own. Okay, so it'll be week 3, week 7 for the 2 group projects. Any questions about that?
Which assignment or which announcement is the groups listed under? I'm not seeing it.
I think I sent it as an email. Did I not? Did anyone see it?
You did as an email.
That's what I thought. Yeah. So it should be an email that came from me to everybody. So take a look at
Oh,
that.
I
If
see.
you don't,
Thank you.
yeah, and if you don't have it, we're gonna meet tonight as group, so we'll be good. But all right, so it's 6:08. Let's take attendance and then we'll move along. Christy,
Yeah.
thank you. Amira, I saw you. Jessica,
Here.
Courtney.
Yeah.
Here somewhere. Okay. Tammy.
Here.
Great. Somebody's having internet trouble. Don't worry about it. You'll figure it out. What I ask, like I did last week, and I do this because Dr. Brown's really big on cameras. I just ask everybody to be on camera during class. So if you're having trouble though, I understand. Kamara,
Here.
Sierra.
Here.
Yeah. Amanda G.
Here.
Sean, I saw you.
There's 2 of us.
Oh, that's right.
2
Sorry.
of us.
Amanda Gaspara.
That's me. Oh, I didn't even realize my camera wasn't on. I'm
Oh,
here.
you're good. Great. Tyler. Is it Tyler? I think we're having trouble there, but I see a person. Lindsay Johnson.
Here.
Great. Angel.
I'm here.
Awesome. I said that right?
Yes.
Great. I'm working on it. Whitney.
Here.
Shauna. See you.
Here.
Great. Dolores.
Here.
Awesome. Megan.
I'm here.
Thank you. Amy.
Here.
I saw Marla and Toby. No Toby, huh? Okay, and Savannah.
I'm here.
Great. Caitlin, I see you up in the corner. And Amanda Green.
Yep.
Awesome. Okay, so everybody's here. That's good for the people I expected.
I'm sorry, Professor. I'm still not on your roster.
You're still not on my roster. I don't know why, Caitlin, but don't worry. Don't worry about it. I'll take care of it. You should
Okay,
be.
thank you.
Yeah, no worries. I know you're on my groups and you're on my email, so I might have
Yeah.
just been some weird thing. Sorry
Okay.
about that.
No,
All
it's
right,
okay.
guys. So what else was I just gonna say? Oh, I remember. I got a couple emails about the discussion post. Has anybody, just raise your hand or say me, has anybody been able to reply on the discussion post?
I have.
You have.
Yes.
No, not for me.
Okay, so I have two students I know that said they can't. So I don't know if it's, we'll have to see why, stay on after class, but I sent a text out to the other professors to see if they had any tricks for it, but I thought you could reply. So most of us can reply?
You can't reply whenever you don't take the 2 quizzes. Like,
Oh, so if you haven't taken the technology quiz?
yep,
I
you gotta
see.
take both those.
Well, you
I-
can't
I've-
even get into the modules if you
can't get on
haven't
the
done that. So.
Yeah, you can't even get on the modules without taking the test.
No?
Yeah, I've done both of the quizzes. I'm not seeing a reply button for me. I'm not sure if it's because the due date was listed as April 20th.
Yeah, so it was listed as April 20th because all posts had to be in by the 20th. What I will do tonight is I will lift that so that it's till Sunday, but I had to get those initial posts in by the 20th. Does that make sense?
Got it. Yep, 100%.
Yep, and so sometimes what happens is the grade book shuts off. It has to shut off until when it's late or on time or whatever. So, but don't worry about that. That'll be lifted tonight, but I'm glad some of you were able to get replies in. That tells me that it's probably not the due date. It's probably some glitch somewhere somehow, but we'll figure it out. Don't worry about it. Any questions before we start tonight? No? All right, guys, we'll make it through. I promise we'll get there. You'll be fine. I think we're going to get really prepared, even more so than we were last week with our material for next week. And so no worries about that. All right, so the first thing I wanted to review with you guys, because this is a huge, huge section in this entire class, and it's primary, secondary, and tertiary prevention. So you should have been reading about this in every chapter up to this point, because you will see it all throughout. What I'll tell you is it's really important because why do we think community nursing has anything to do with prevention?
Because community nursing, that's the primary goal, is to prevent diseases within a community.
Good. So that's would be our primary. We're going to be preventing. What else do we know about prevention in the community?
It's easier to prevent something from happening than it is to treat it afterwards as it progresses.
Okay. And if we're treating something, what's our goal? Think med surgery here. What's your goal when you're treating something?
Management.
To prevent it from coming back.
Good. Prevent it from coming back, prevent it from getting worse, right? Prevent it from moving on to where we have complications. So this is really where we see primary, secondary, and tertiary prevention. And what I have for us tonight is actually 2 videos on it, because I really we're going to do 2 videos on it, and then we're going to do a Kahoot on it, because I want to drill home to everybody. Our 3 levels are going to be primary, secondary, and tertiary. Primary, and I'm like a mnemonic person, so this is how I remember it. P for P. So primary, you're going to be preventing. Okay. You go to secondary, and there's another S there, and that's going to be screening. Okay. And then you go to T, which is tertiary, and that's treating. So by the time you get to tertiary, it's kind of like a pyramid, right? So you try your very best to prevent everything from happening. But then if you're being exposed to something, or you're of age to get a mammogram or of age to get a colonoscopy, you're going to do those screenings, right? to make sure that you're not having disease process. And then you go to the tertiary, you're going to treat. And our goal is always to minimize, right? We always want to minimize the effects of any illness. So we talked a little bit last week about how community and med surg and OB and peds are all going to like overlap. So one of your classmates was worried about this class because they had heard it was very difficult. And so what I want you guys to have in the mindset when we're in class is I want you to have a med surg OB mindset and peds mindset. This isn't just about we're going out and we're talking to communities, right? I want you to really think about, if I were a pediatric nurse, how am I going to use these things I learn in community in pediatrics? And we're going to see on our exam, and you're going to see on your HESI, and you'll see on your NCLEX, content from community oftentimes overlaps. So they'll use a med surg scenario or like a peds scenario, and it'll be about primary, secondary, or tertiary prevention. Has anybody talked about this in any other class? The primary, secondary, and tertiary?
We talked about it in med surg.
Awesome. Fabulous. I'm glad to hear that, because you want that basis. And so I'm going to review on this, because to probably what you guys are going to think is nauseum. But the reason I do that is I really want you to get the concept. Okay. And if you have any questions, it should be pretty clear. So I will tell you on the HESI, this is an area that sometimes people struggle on because they get a little confused. But if you remember the primary prevent, secondary screen, tertiary treat, I feel like you guys will get this when you see examples. All right, so we're going to take a look at the first video, and it's going to be primary and secondary together. And so we'll take a look at that. Let me share my screen to make sure I do everything right. Hold on one second. Where am I? It's here, but that's not it. I knew it. Oh, yes. I was like, I pulled everything up. So this is on study.com. And the reason I like this is because what ends up happening with this is they break it down pretty simply for you, because they don't really know who's watching it. So I really like these videos. So let me maximize. Can everybody see my screen? I can't see you. Can you give me a yes?
Yes.
If you're playing it safe in life, as well you should when it comes to health, you try to prevent a disease or injury before it happens. For example, if you wear a helmet, then you're trying to prevent cuts and scrapes to your head or brain damage from an accident. In some cases, however, it's too late. In other words, you already have some sort of medical issue, but it has yet to cause you serious or noticeable problems. What do we do in these cases in order to try and minimize the impact of the disease process? We turn to the concept of secondary prevention. Secondary prevention refers to interrupting an asymptomatic disease before it becomes symptomatic, or at least catching a disease at its early stages when few signs and symptoms are present. In other words, you've already gotten sick, you just don't know it yet, or you're only beginning to suspect it. Secondary prevention tries to intervene and hopefully put an end to the disease before it fully develops. Primary prevention is concerned with preventing the onset of a disease, while secondary prevention tries to reduce the number of new or severe cases of a disease. Even if we can't prevent the disease from becoming overtly symptomatic, we can at least reduce its impact with secondary prevention. As the saying goes, it's better to nip it in the bud. By targeting people who have recently been exposed.
Oops. How did it stop on me? Hold on. Oh, yeah. All right. Well, that one they cut short on me, but I don't know why. All right. So we're going to stop right there. So primary and secondary, we're going to look at some examples. What's an example you think of a primary prevention that we could do with kids? Let's do kids.
Immunizations.
All right. So immunizations, what we're going to see with immunizations is that's going to be usually secondary. But sometimes it's primary. It depends. On kids, it's usually primary. But
So that'll be
let's not do immunizations because that gets really blurry. Let's pick another one.
like bike helmets, knee pads, when they're riding their bikes or riding whatever, skateboards, whatever they ride. Stuff like that.
Car seats.
Okay, so
Seatbelts.
what would we do with our patients? What are we going to do about car seats?
Educate them on proper placement.
Good. Anybody ever work in the NICU? No. So in the NICU, before they send a baby home, they do what's called a car seat test.
Yeah, my son had to do that. They have
Yeah.
to sit in there for like an hour or something, like without like getting super fussy.
Yeah, and they like to also make sure the babies can breathe.
Yeah.
You know, in the car seats, because a lot of times in the NICU they're little and they don't fall out is the other thing. But they watch for apnea in those. But anyway, other primaries that we could see. How about with adults? What kind of things are we going to do with adults?
Would that be like encouraging a healthy lifestyle and exercise?
Good. So you're going to teach them about healthy lifestyles. You're going to educate them on healthy lifestyles. Good. What else
Would
can we
that
see?
be like identifying things in their family history that could predispose them to something else? So like a family history of diabetes or colon cancer or something like that.
Screening though.
Yeah, good. That would be screening. But yes, what you could do is to a group of 45-year-old women, what could you do for primary prevention?
Teach a self-breast exam.
Once we get to the mammograms, that's going to be screening. Okay. But our primary goal with primary stuff is really teaching, right? Because, for example, tobacco use with children, you're going to educate them as young kids so that they don't get exposed as, you know, so they don't start smoking at 15 or whatever, whenever they can find the vapes or the cigarettes or anything like that. Does that kind of make sense? So primary is going to be way before. You're not going to have anything going on. When we get to our screenings, what kind of screenings do we know other than mammograms, where you might have something in there, but you don't know, so you screen for it?
Depression.
Colonoscopy.
Colonoscopy is a good one. Depression. Yep, you do depression screenings. Yep. What else?
The testicular screening for men.
Yep. What are we going to do with little people? What kind of screenings do we do?
Scoliosis.
Yep. How about kids that may be having some trouble in school? We're going to do a screening, and there's several different ones. There's a Vanderbilt, which is an intelligence screening. There's ADHD screenings. All those kind of things we do with kids, right? And if you ever have taken your child into the pediatric office, what they end up doing is going through all their growth when they're little. They'll go through all their growth phases, what they should be doing, and their screening, is this happening, those kind of things. Now, once they say to you, or once you say, well, no, they're not speaking yet and they're 5, then we're going to move a little further, because then, does everyone understand? Because then you already have something cooking that is not typical of a 5-year-old, right? Does that kind of make sense?
Yeah. So what
Right.
eye exams from like the Snellen chart, is that part of the screening? Is that a considered screening?
Yeah. Because on the screenings, sometimes the way to think about it too is with screenings, you may find people that don't pass the screening, right? Any screening that you do. Does that make sense? So when I want you to look at this, I want you to keep in your mind, you're trying to prevent things from happening with your primary. With your secondary, you have a group of people that potentially could have something. So then you're gonna screen them to see who does and who doesn't. And by the time we get to tertiary, they already have something. So when we go to tertiary, we're gonna do a ton on treating. So you're gonna do support groups for diabetics. You're gonna do, what other kind of things would you do? You're treating a condition.
Medications, making sure they compliant.
Okay, so we want to review their medications. Yeah. What other kind of things might we do?
Like their vital signs, like an assessment.
Well, why are you taking their vital signs? Do they already have a condition, or they're obese and eat poorly?
I mean, with the treatment,
If you're treating them for anything, you would want to see what their baseline is, right?
Because you need to monitor them to see if their condition is worsening, but if you don't have baseline vitals, then you don't know if it's worsening or if that's their status quo.
Okay, so with baseline though, that might fall under screening, but once they're being treated with meds, then you're gonna get what their baseline is on the meds. So yeah.
Okay.
Does that make sense? You just have to be careful the circumstances as to which you're applying them, you know? And that's really the key with primary, secondary, and tertiary. Let me see if the tertiary video will work, but it's acting funny, so let me see here. It played just fine for me earlier, but you know, what do I know? Okay, let me share my screen. Let's see how we do with this video if it gets funny on me.
James is a nursing student in his
Are you guys seeing that?
last term for his Bachelor's of Nursing program
Yes.
at a university.
Okay.
He is required to complete a clinical experience in community health and population-based nursing. This field of nursing aims to promote health and prevent diseases among a selected group or population. James decides he wants to complete his fieldwork on the prevention of cardiac disease in his community, which he has discovered through research is a leading cause of illness for this local population. James would like to focus his clinical work on the nurse's role in tertiary care and prevention. There are 3 categories of preventative care that nurses focus on when discussing the health care of a community or population. Primary prevention includes measures taken to provide people with knowledge of disease prevention before the onset of disease itself, by arming communities with information on healthy lifestyles, risk factors, and behaviors. Prevention is the best and most cost-effective method of ensuring the health of a community by preventing diseases from occurring in the first place. Secondary prevention is a form of early disease identification and treatment. It might include screenings, detection, and determining family history and risk factors. Early treatment through modifying lifestyle choices, medication therapy, and catching diseases in their earliest stages allows for better control and management of symptoms. Early treatment can significantly alter the development and manifestation of chronic conditions, which results in fewer doctor appointments, emergency room visits.
Oh, see, it keeps cutting out on me. It hasn't done that before. Okay, well, I'll register with there. Okay, so there you see here, and I was just as he was doing the blood pressure. So blood pressure screenings on a population at the local clinic is going to be secondary, because out of our findings, we're going to find some that are going to have high blood pressure. But once you have it and you're treating it with medication, that's not where, you know, we'll have a baseline for a medication. So that would be tertiary. I just wanted to clarify on that screening one when I saw the blood pressure cuff, because that's a little hairy. All right, let's do a Kahoot and it'll give us some examples. Everybody know Kahoots?
No.
Sort of. No? Okay, so it's going to be a game. You're going to go to Kahoot it, and then I'll give you a pin. And you put the pin in, and it's like a little question, and we do it all together. You pick the color on your screen, and you'll see the answers on my screen. Okay?
Where do we go?
Kahoot it, K-A-H-O-O-T. Yep. Thank you, Jessica. She's got it on her phone. She's showing everyone. Look at Jessica. There's also an app. Christy's telling me, so good. Good, Dalen. Yep. There you go. So I like to do these because it allows us to practice together. So it's like little, not a test by any means. You have to sign in, put a name in, but hold on. I'm going to give you the pin. Is everybody on Kahoot?
Yeah.
Yeah.
Yeah, yeah.
Game
Yeah,
pin.
yeah. Okay, hold on. Let's go to our Kahoot. Okay. I'll share my screen in a minute. Okay. Right, so here's your pin. You put your pin in. Can everybody see it? So you're gonna sign in as your name. So pin is 2808690. Can everyone see my screen? Just say yes or no. Oh, yes. Good. You don't have to put your real name in. You can put whatever you want. So don't worry. I don't even pay attention to who answers. I don't see who answers what. I like that one. Somebody's name is Shine. I like that one. All right, we all signed in. We're not all signed in. I have 20. All right, we're gonna start. Everybody ready? Here we go. Okay, define primary prevention. Actions that prevent the initial occurrence, actions to reduce the occurrence, screening to identify diseases, managing diseases post-diagnosis. Come on. It's slow tonight. All righty. So we got almost all of it. Good job, guys. Somebody who answered the correct answer, tell me, what was your clue when you saw that?
Prevent.
Yep.
Prevent.
Yep. When you see that word prevent, it's always going to be good if you're defining. Okay, here comes an example. Okay, routine treatment to terminate the disease, replacement of lost tissue through rehab, Ppd test, and delay the onset of disease. All righty. So looks like we struggled with this one a little bit. Somebody who answered blue, I can't even see you guys, so I don't know who's talking, but somebody who answered blue, what was your thought on PPD?
So my thing, I thought primary prevention, in green, it says reverse its progress or stop it. But that doesn't seem right to me, because if we're preventing it, it's not primary prevention if it's already there, right?
Right, it sounded like they
So
already had it.
I didn't know what PPD was, but I didn't think any of the other ones sounded right. So I chose PPD.
Okay, good. I love it. I love the honesty, and thank you. The good thing about this question is that it's helpful for like a test. So a PPD test, anybody know what that is?
Yeah, it's a tuberculosis screening.
Yeah, they stick a little thing in your arm and it blows up like a bubble and you measure it. So when you read this, what do we know a PPD test is doing?
Screening for
Screening.
TB. For TB. It's a screening.
Right. Okay, it's screening. If you didn't know what PPD was, that's a little difficult, and I apologize for that one. On routine treatment methods to terminate the disease process, what word do you see there that's going to identify that it is not primary?
Treatment.
Mm-hmm. Good. And replacement of lost tissue through rehab. What is that?
Treatment.
Yeah, definitely treatment. So our best answer here would be delay the onset of disease. The reverse its progress or stop it. That's not really, you're not going to have the disease process with primary. But when you look at these questions, and I didn't make this Kahoot up just so we are aware, because I would not have put the reverse its progress, but it's okay. So when you're looking at this is a good practice for an exam. Your only choice there would be your delay the onset of disease, right? Because none of the others, so it's process of elimination. Have you guys done test taking skills?
Yes.
Yeah. And so that's sometimes what you have to do. Now, if you didn't know, what my instinct would be, if I didn't know, I'd be between blue and green, our PPD test and our delay the onset of disease. So I understand where 5 came from, I mean, blue came from, but if you know what a PPD test is, which goes back to, I think med-surg, but I don't know. If you work in a hospital, you've had it done everywhere you work. All right, that was a good one for test taking. Ready? Here we go. This level of prevention is primary. Assessments and care, hepatitis B vaccine, teaching a client in rehab, encourage regular medical checkups. Okay, so here's where a vaccination comes up. Somebody tell me what you thought about regular medical checkups.
Well, my first thought was Hep B, but you just told me that immunizations are not part of primary prevention.
Yeah, because they can be primary or secondary, that's why. Depending on your group process. So it would be secondary if you had a group of teenagers. What vaccine for them is going to be secondary?
HPV?
HPV?
Yeah, but for a matter of test taking skills, what I will tell you is this. Here, let me stop this share screening. What I'll tell you for test taking skills is most vaccinations. This is why I don't like this question. We should have skipped it. I don't like to get into it because then everything gets a little gray. But for test taking purposes, vaccinations are going to be primary because we're not going to worry about the group. So Marla, when you answered, you were the one who answered about vaccines, right? I stay away from doing that in my lecture because it can occasionally change if you have a group of people that is
Like
exposed
STD
to
stuff?
something, right?
Yeah, okay.
That's where it gets blurry.
Yeah.
So, but for our sense of purpose, what I want you to do is when you think about vaccinations for test taking purposes, then they will be primary. Don't look at the circumstances around it. We're not going to give you one like I'm describing, but I can tell you, I want you to just know that. So Marla, you were correct, but the reason I was avoiding the conversation is because it gets very gray. So it's easier for me to say, let's not talk about it. I know it was on the Kahoot and that reminded me, you're going to have a question on your test that has something to do with primary
So
prevention.
immunization is considered prevention for
Mhm.
test.
For test taking purposes, yes. So you could just say for immunizations for a matter of discussion, we'll just say they're primary. I won't ask you that again, trust me. We'll skip it on the next Kahoot. All right, we've already done this to nauseam, so let's skip that.
Is your screen still sharing?
No, I'm just making sure that, okay. I'll share in a minute. Oops, sorry, not that one. This one we can do as a group. We can put it in the chat. All right, so we talked about this one. Somebody did this one for levels of prevention. So somebody had that there. Okay. All right, so levels of prevention is going to be important here. I'll stop there. And so what I want you to do is I'm going to give you some examples. They're in your book. So we can take a look at those as well. This always is a blurry topic for people. Is it still blurry? Yes, you can say yes. It's okay. So we're going to go over a little, let's do a PowerPoint on it and see how we do with that one, if that helps at all. Because this is always a hard topic and we will see it quite a bit. Okay. Okay, can everyone see this screen?
Yes.
All right. So what I want you to do is look at our examples here. We're going to have health promotion activities, teaching healthy lifestyles, and immunizing children for school entry. These are going to be our primary. Remember I said for all purposes, immunizations is going to be primary. Secondary, we're going to be screening. You'll see on exams the word screening. And then for tertiary, we're going to be caring for people who have problems. Does that make it a little clearer? All right, we're gonna look at one other slide that I have for you on prevention. Let's see if I can share this. Alrighty, so here we're gonna have primary, we're preventing, secondary screening, tertiary treat. So we're gonna try to prevent disease and dysfunction. We're gonna use something like Healthy People 2020, which you guys were gonna review this week, because these are things that we can do to try to prevent anything from happening. When we get to our secondary, we're gonna be screening. Our activity is gonna be screening. And people who we're screening are going to be those that we don't know if they have something. And then tertiary, we're going to have, we know we're going to prevent our deterioration from a disease. So what kind of activity will we see is rehab. So what I want you guys to focus on this one is for our activities. We're going to reduce risk factors with our primary, with our secondary, we're going to screen. And for our tertiary, we're going to do some rehab. How are we feeling about it after that? Better? Still blurry?
Better.
Good.
Good. All right. So, any questions on primary, secondary, or tertiary? No? Okay, we're going to move on to vulnerable populations. Did you guys do the reading on vulnerable populations? Do you remember? It was last week's reading. That's what I'm asking. All right, so when we look at our vulnerable populations, they're going to be our homeless, mentally ill, substance users, veterans, and migrant workers. When we look at why are these people vulnerable, we're going to see poverty as our primary cause. Okay, and it's a growing problem. So think about the stress of poverty, unemployment, poor education. All of these groups are going to have this. And so they're going to have more likelihood to have poor health outcomes. So know that if I were to ask you something like, who's included in your vulnerable population, we're going to focus on our homeless, mentally ill, substance users, veterans, and migrant workers. We know why they're vulnerable is because of the stress of their lifestyles. Okay, you're going to be doing a windshield survey on week 9 of a vulnerable population in your community. So does anyone know of one that they can think of off the top of their head that's local?
You said a windshield survey?
Yeah, we'll talk about that in a little bit, but you're gonna what you do is you drive. A windshield is just you get in the car and you drive, and what do you see at the windshield? That's a vulnerable population.
I see a lot of homelessness.
Yeah, homeless here too.
Homeless and substance abuse.
Mm-hmm.
Can you go back to that slide that had the vulnerable population? I didn't.
No worries. Yep. So they're going to be the groups of people that are going to have a higher risk of health outcomes. They're going to have different things that make them more likely to develop disease. Like think about the homeless. What are some things that they have that make them more likely to become ill?
Lack of shelter, so they're at risk for like being stuck in the weather and things like that.
Okay, if they're stuck in the weather, what will that give them?
I mean, they could get like frostbite or
Sunburn and the heat, skin cancer, from being in the sun.
Right.
They have lack of good nutrition.
Yeah, food's a big one on the homeless. Absolutely. So what is the lack of nutrition going to do for them?
Slow they like wound healing down if they get hurt, the wound healing process.
Okay, what else do we know about nutrition?
Those bones will become fragile.
Low potassium or sodium can cause them to have neurological or cardiac issues.
For sure. What's something we know about substance users? What puts them at higher risk?
Needle sharing.
Needle sharing. What else with substance users?
Infections.
Good. Tell me a little bit about infections.
Well, it can go to their heart pretty easily.
What'd you say? I didn't hear you. What?
It can go to their heart pretty easily.
Okay. Do something to cardiac. What else? Substance users. Needle sharing, we said, which is a big one. What else happens when you're a substance abuser?
And a lot of communicable diseases.
And then like alcoholics can cause liver problems, cirrhosis.
It affects your immune system.
Absolutely. What else is it going to do to the brain?
Memory loss.
Slows
You're gonna-
response.
They're probably the life choices that that people are going to make when they're using some sort of substance, whatever that may be. Do you think those are going to be the same as someone who's not using?
No.
No. So they put themselves at risk because of lifestyle choices, right? Mentally ill, what do we think about them? Why are they going to be more vulnerable?
Because
They may not be able to.
they're not on medication. You don't know if they'll ever have like a episode.
Anybody work with the mentally ill?
I did.
I have a few like less severe cases that come to my office.
But
And,
less severe cases, Amanda, don't you agree, can get to worse cases, right? Just because they're not.
Oh, for sure.
Right? So
for
think
sure,
about
yeah.
that. Yeah. Think about what kind of choices mentally ill people are making. What do you think?
Unsafe choice.
I would say a lot of times it's poor because like a lot of the ones that I deal with, they either have auditory or visual hallucinations, and like they make decisions based on what they think the voices are telling them, and they think that is the best judgment because somebody's already advising them, which is could be anything from the Cookie Monster to they could think it's the police department telling them or the government. So
Good. Yeah, and sometimes their choices may not be as realistic or well thought out as someone who doesn't have mental illness, right? And it's not their fault. That's why
Right.
it's an illness, right? So remember that when we're talking about our vulnerable populations. So we understand why their health is going to be impacted with our vulnerable population group. Any questions on that? Because that covers pretty much chapter 21. That's what I want you to know out of 21. With your windshield survey, what I want you guys to start doing now is I want you to be, as you're driving around in the car in your neighborhood, I want you to keep an eye out for a group of people or a vulnerable population that you can identify. Because what you're going to do is you're going to describe them and a whole bunch of things in week 9, which we'll touch on maybe next week.
So I have a quick question.
Yep.
So a lot of these kind of include 2 populations, because I'm thinking about the veterans who are often homeless in my community.
Sure.
And the same with the mentally ill, they're often homeless. So
absolutely
we combine those.
What do you think that's going to do to their risk factor of disease if they're parts of 2?
Increase.
Yeah. Right? Because if you're part of one group that has a higher chance of poor health outcomes and you're a part of 2 groups. Good job, Dolores. I'm glad you observed that because that does happen. They overlap for sure. There's a theory out there about homeless and that, homeless people and mental illness, they run hand in hand because nobody would make that choice nobody would not want to have a home to live in. All right, good. So that is our vulnerable populations. Any questions on that?
I still had a question. Would like how Denise was saying, the veterans and the homeless, would that make a higher risk for like a suicide with that type of situation?
Yeah, it's higher risk for every kind of health disease process you can imagine. Think about homeless and mentally ill And what tends to happen is they eat whatever they find. Do you think they're going out and running and exercising and doing what you're supposed to do for your cardiovascular system? Probably not. You know, so think about what kind of health complications could you see easily just from those lifestyles alone? You know, you can see hypertension, you're gonna see diabetes, stroke, heart disease. You know, these groups are not necessarily I mean, I wouldn't make a general statement, but think about, are they going to be going to like their doctor and getting health screenings? If anyone knows about the work that is done with the homeless population around the world, is a lot of times community nurses will go out and reach out to them because healthcare for them is the last priority. So that's a really good area to explore if you are interested in that. What's happened with the homeless community in major cities, I know in Denver and in Manhattan, it's both the same. They have these needle sharing centers, and it's for substance abusers as well as homeless. So what they do is they hand in their needles and then they get clean ones. And so there was some controversy as to why are we doing that? But the truth of the matter is, if somebody's looking for a needle, they're not going to care if it's clean or dirty. So why not give them the clean ones, you know, and help prevent as much as you can. So good thoughts on vulnerable populations. As far as your test is concerned, I would focus on what groups we're identifying. And I want you to use your mind like you guys have been doing in our discussion and saying, why is this, what makes them higher risk of health illnesses? And you guys came up with some good ones. Good on that one. All right, the next section that we're going to do in class is all about families and family assessments and things like that. So what I'm going to do at this point is we'll take a break for 10 minutes. So you guys shut off the cameras and we will come back at, what is it? 9:02.